Dr. Mankal here. I want to talk to you guys about our unique approach to scoliosis management. We see a lot of scoliosis cases in the office and we get questions all the time. It affects kids, 2 to 3% of them that we're seeing today. Most common are the adolescent idiopathic, which the cause is not totally known. And a lot of them are developing without any symptoms, so that's the importance of getting checked early. So we really recommend kids getting checked, especially females between the ages of 9 and 12. That's when the years where they're growing the fastest, and that's when you can have the biggest impact. Because of our uniqueness in the practice, we focus on neurostructural care, and we use some of the traditional chiropractic care, but we focus on neurostructural care. And that's like looking at a foundation of a house. You really want to try to balance or restore structural function to the column, because that really what happens at the top. And so one of the ways that we do that is in the neurostructural process. If someone, for example, presents to us with a curvature of the lumbar spine to one side, one of the ways that will help to restore that is something that we would do an overcorrection, so reverse the image. We can have them lying on a certain posture block, and so if the curve is actually to the right, they would lie on the right over this little rehab block here, and we'd actually make some corrections and using certain instruments to stimulate the neural pathways through here. Or we'd actually show the patient how to use a specific exercise on how to rehabilitate and change the neuroplasticity of the nerves that are going through that part of the distorted part of the spine. That's part of the rehab process. Some people may require more advanced type treatment with regards to scoliosis bracing. I have an example of one here, not my most favorite colorful one that we have. This one here is more designed for an elderly person who has a degenerative scoliosis. For them it's not so much about correction, it's more so about pain management and mobility. And lots of them have really enjoyed being able to walk longer, having a whole lot less pain because they're more stabilized in the brace because there's just more advanced instability from that process. But many of the younger braces for the younger kids, they come in nice colors and things, and they're easier to wear and a little bit more enjoyable for the kids. So that's more for different curvature amounts, and they may require a bit more help using the bracing process. So that's kind of our unique process here in the office with regards to first of all the neurostructural examination to see if what structures are distorted, if there is a scoliosis, what type of rehabilitation, what type of corrective neurostructural adjustments are made. So that's kind of the whole process together, and to shed light to some parents in here that there is a way that you can actually help scoliosis, especially in the younger years, to actually correct it and prevent it from progressing. And the research really shows us now that a non-surgical approach is the best approach at the beginning of care. And that's what we want to take, because obviously surgery has its own inherent risks to go with it. So that's some insights on some of the neurostructural process and scoliosis care that we offer here in the practice. So until next time, we'll see you soon.